Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm pleased that you could stay with us for this third segment today. Thanks so much for being here. The next topic I would like to discuss is body contouring. One of the most common requests I see in my office as a board-certified plastic surgeon is the request to recontour the body, whether it's for a tummy tuck or a liposuction or to modify the hips or arms or breasts. Body contouring is a very common part of most plastic surgeons' practices these days, and it's a very common part of my practice. When I talk to people in the office about body contouring, I like to go over the fact that there's two basic approaches to body contouring. There's what I call the closed approach and the open approach. Let's start with what I call the closed approach to body contouring, which is essentially liposuction. Liposuction, or fat removal, is carried out by making very small access incisions, usually not wider than the head of say a pencil eraser. That's just a few millimeters in length. So through that access incision, we can insert a tube or cannula, and then that tube or cannula is attached to suction, and that allows us to vacuum out the fat or suction out the fat. Now, there's many ways to do that. One of my favorite ways to do liposuction is with what's called the Tumessa technique or super wet technique. Now, there's something called Hunsted's formula. That's essentially a very dilute local anesthetic containing epinephrine and also some buffer solutions and buffer chemicals that will actually make that fatty layer numb and actually make the vessels constrict. Now, sometimes people will say or wonder, when the cannula or tube is inserted, doesn't it damage other structures or doesn't it harm other structures in the body besides the fat? Actually, by doing the super wet technique, the Tumessa technique, and by using blunt cannulas, the nerves and vessels typically are just moved aside. They can be bruised, or you can come in contact with the nerves and vessels with the cannula. But in general, especially with the use of epinephrine or an artificial adrenaline added to the solution, the vessels constrict, and with all that fluid added to the fatty layer, the tube in general or the cannula in general can vacuum out the fat. It may move up against the vessels or nerves, but typically will not damage them. So the closed approach to body contouring essentially is liposuction. Once again, that's when small access incisions are made in the skin, and that allows us to insert a tube or cannula and connect it to suction, and therefore we can vacuum out the fat. Now, while doing that, I like to do sculpting. It's actually surgical sculpting, where that fatty layer in the body, while we're doing body contouring, can be sculpted, trimmed, and tailored. It's much more than simply inserting a tube or turning on some heat and vacuuming out a localized area of fat. We need to be very cognizant of the skin level. We need to be very cognizant of where we are within that fatty layer. We can't go too deep. We can't go too superficial. And it's a process of sculpting, molding, and shaping. And that's part of plastic surgery. As I've discussed before, the root of plastic, or the root of plastic surgery, is plastiko, and that's from the Greek meaning to mold, shape, or tailor. So when we do liposuction, it's actually sculpting and molding that fatty layer in the body in general to achieve desired results. I think that each approach, the closed approach and the open approach, has advantages and disadvantages. In other words, there's pros and cons. The advantages to the closed approach, or liposuction, essentially is that the access incisions are very small, and hence the scars are small, and as well we can remove lots of fat. It's very effective at removing large volumes of fat. However, the downside is it cannot remove extra skin, and we can't tighten up muscles on the inside with the cannula. Now, as I said, there's lots of ways to remove the fat. There's other ways, such as the vaser. There's ultrasonic emulsification. There's even a type of laser that produces some heat and can sort of melt the fat cells. I think that those have their place, but I think in in the hands of a skilled, experienced plastic surgeon, at least in my hands, the tumescent technique, where I use fine cannulas, micro-liposculpture, and mold and shape and tailor as I go, I think that that's very effective and can give the most predictable results. Now, a couple words about the use of laser. I think that lasers have real indications. I think that they're very effective at improving or changing and affecting the texture of the skin. However, I think that when we expect lasers to have dramatic effects on the volume of the skin or the size of the skin, and when we expect lasers to shrink the overlying skin when we do liposuction, I think in general, my opinion is that that can lead to disappointed patients. I think that for younger patients or for people with lots of skin resilience or resiliency, I think the skin will retract and contract to assume the new shape of the fatty layer underneath. However, for people who lack a lot of skin resilience and there's lots of extra skin, I think to expect the laser to shrink that skin a great deal really does, in my opinion, lead to more disappointed patients. So I think that the tumescent technique, making small access incisions, using finer cannulas or tubes, and molding, shaping, and tailoring that fatty layer can, in my hands, give the best results. Certainly there are indications for the use of the ultrasonic liposuction, such as the Vaser. That can be a very powerful tool to do large volume fat removal. But as I said, to expect a laser to do a lot of shrinking of the overlying skin, I think we need to be careful about that. That's my opinion. So that's the closed approach to body contouring, essentially liposuction. Small access incisions are made. Typically Hunsted's formula, the very dilute solution, is infused. It loosens up the fatty layer. It makes the vessels constrict. It makes the area numb. And then we insert fine cannulas and we mold and shape and tailor while we remove fat. Now, the open approach to body contouring, that's the other category. The open approach is where we make incisions that are typically long. We can remove blocks of skin and fat, and we can tighten up the muscles inside when needed. For example, a tummy tuck or abdominoplasty. That's an example of an open approach to recontouring or body contouring for the abdomen. When we do a tummy tuck or abdominoplasty, oftentimes the patient has loose skin, whether because of their age or because they've lost a lot of weight or because of multiple pregnancies. Oftentimes there's a redundancy or too much loose skin for liposuction really to be effective. Now, for those patients, we can still do liposuction, but sometimes I'll do that as an adjunct. In other words, in the anterior portion of the abdomen, say after pregnancy, let's say I see a woman who's about 45 who's had 3 or 4 children, and she's decided that she'll have no more children, and she has loose skin and fat, and she'd like a more narrow waist. Well, she's more likely to get a combination approach of liposuction and a tummy tuck or abdominoplasty. The liposuction typically we'll use to give her a more narrow waist. We'll do the flanks, which is the fatty collection towards the lower end of the back on the right and left. We'll do the waist. And then for the anterior abdomen, we'll typically remove a block of skin and fat. Now that leaves a scar, but of course it's really good at tightening up the skin. So the open approach, as I've said, has pros and cons as well, advantages and disadvantages, as does liposuction or the closed approach. In my practice or in my mind, as I see it, the open approach advantages are that we can remove big blocks of skin and fat, we can tighten up the muscles if we need to. However, the downside is it leaves permanent, visible scars. So when I see people in the office and they say they want a tummy tuck, but they're not willing to have the scar, well, we need to talk about that because I think that comes under the realm of unrealistic expectations. Now, the length of the scar can be highly variable, from what we call a mini abdominoplasty to a standard abdominoplasty to what I call an extended abdominoplasty. And there's even something called a belt lipectomy, where the incision will go circumferentially around a person, around to the back. Oftentimes we'll reserve that for people who've lost lots of weight, massive weight loss, over 100 pounds, and they have extra skin not only on their back, but on their flanks or sides and abdomen as well. So let's start with what I call the mini tummy tuck or mini abdominoplasty. That's best reserved for someone who has just a small amount of localized excess skin in the central lower part of the abdomen. And I can make a relatively shorter scar, relatively shorter incision that doesn't have to go hip to hip, but just maintains or just stays within that area of what I might call the bikini line. In other words, it can be hidden with a two-piece bathing suit. So through that shorter incision, I can remove a block of skin and fat, and I can slip in underneath and tighten up the muscles if need be, particularly caudal or under the belly button. Now, if I need to remove a lot more skin or I need to tighten up the muscles above the belly button, that typically comes under the category of a standard abdominoplasty or tummy tuck. That's when the incision goes from the iliac crest to iliac crest, or what we might call the hip to hip incision. Through that incision, I can remove a much bigger block of skin and fat. I can tighten up the muscles above and below the umbilicus or belly button, and I can oftentimes shore up the muscles on the side as well. That's a standard abdominoplasty. But again, it leaves a long, permanent, visible scar that will typically run hip to hip. Now, oftentimes, people will ask me, well, what about the belly button? What happens to the umbilicus? Well, the umbilicus or belly button typically remains on its stalk or its root. We make an incision around the belly button, around the umbilicus, through the skin. And then when we remove the extra skin and fat underneath, we'll have to recruit the remaining skin, we'll bring down the skin, and then the belly button will come up through a new hole, but it remains on its stalk or its root. I explain this in the office where I ask people to think about a wrinkled bedspread. And what we do in a tummy tuck is very similar to having a wrinkled bedspread. I lift up from underneath, I undermine, which is essentially surgically breaking up the connections between the skin and fat and the underlying muscle layer. I'll cut the umbilicus or belly button free, and I'll continue to undermine all the way up to the rib cage. Picture a wrinkled bedspread where we do this. And then what we do is we pull the remaining skin down, just as you would straighten out a wrinkled bedspread. We cut off the extra, we sew it up. Oftentimes we'll put drains in, and we'll bring the belly button in that remains on its stalk or root. We'll bring it up through a new hole. So that's called a standard abdominoplasty. Now, for people, especially women, who are concerned about their flanks, oftentimes they'll come in and they'll say they have the muffin top phenomena. The muffin top, they tell me, is when people wear pants or tight jeans and the tissue on the flank just above the love handles seems to sort of overflow over the waist belt. For someone who has lots of extra skin and fat in the flank area, or they want to get rid of their muffin tops, I'll often do a combination approach of liposuction to that area and bring the tummy tuck incision around to the back slightly. That allows us to remove that extra block of skin and get to the fat. I talked about the circumferential approach, or belt lipectomy, or circumferential lipectomy. That's typically reserved, as I said, for people who have lost massive amounts of weight, or for some other reason have lots of extra skin. For example, after having a gastric bypass or having a lap band placed and someone loses over 100 pounds, they'll have lots of extra skin, not only in the tummy, but the waist and the back as well. So, as I said, we can oftentimes tighten up the muscles on the inside if we make the open approach or tummy tuck. Now, the open approach to body contouring can also be applied to the arms, or we can do the closed approach, that's liposuction, to the hips, or so-called saddlebags, to the love handles. That's a popular area for men. Some of the most popular areas for liposuction for men could be just under the chin, or for the so-called love handles. For women, it can be the sides of the hips, or the inner hips, and around the abdomen. So we can do this open approach or the closed approach to body contouring in many different areas. Each has pros and cons. There are advantages and disadvantages. So I think it's important when you see a board-certified plastic surgeon to discuss those issues openly and fully so you can make a fully informed decision as a patient, a client, and a valued customer. So, thank you so much for being here. I appreciate you joining us. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. I hope you join us again soon. Thanks so much for being with us.